The virus still has hold on us, infecting people and putting them in harm's way, and we need to remain vigilant.
Good evening, everyone. Thanks so much for joining us on this Sunday. I'm Lindsay Davis. We begin tonight with the increasingly desperate situation in COVID hotspots across the country and the fears of a fourth wave. Frontline medical workers in Michigan tell us the virus is spreading like wildfire there. Hospitals filling up, some patients facing 8 to 10-hour wait times. The state's governor begging the federal government again for more vaccines. At the same time, the U.S. has just hit a record number of vaccinations in a single day. More than 4.6 million shots reported on Saturday alone. And by the end of this coming week, 42 states will have opened eligibility to everyone 16 and over. But the pace of vaccinations could be slowed with the supply of Johnson & Johnson doses plummeting. And health officials warn about an uptick in cases nationwide. ABC's Trevor Ault leads us off tonight from New York.
Tonight, healthcare workers on the front lines in Michigan battling the worst of a new coronavirus surge, saying the virus is spreading like wildfire.
It's breaking our hearts. We're exhausted emotionally.
ICU nurse Kim Stasik telling us Monday was the worst shift of her 15-year career.
I was going room to room to room for all 8 hours, and there was nothing else that I could give them, nothing else that I could do. You just wait and watch and hope that they make it through your shift.
With hospital admissions in the upper Midwest jumping nearly 30% over the past week, north of Detroit, nurse Jeff Morosky says patients are facing wait times of 8 to 10 hours.
How does this compare to the worst of it last year?
I think it's worse. We don't have enough, people to give the care that we need to. Nurses are leaving in droves.
The federal government now sending Michigan more personnel to administer vaccines, though Governor Gretchen Whitmer doubling down that what her state needs is more shots.
When there is a surge, we think that it's important that we rush in to meet where that need is.
And tonight, the country bracing for an 85% drop in the supply of the Johnson & Johnson vaccine this week. A potential speed bump just as a record 4.6 million shots were reported on Saturday.
Last week, we got around 20,000 doses. This next week, we're only getting about 2,500 doses.
And health officials say in that wait for the vaccine, younger adults are getting infected. Like New York's Alfredo Hercules, an active, healthy 39-year-old now reunited with his family after 72 days in the hospital.
This is the second chance, and I'm not going to waste it.
Grateful for that second chance. Trevor Ault joins us now from a mass vaccination site here in New York City. And Trevor, there's a new study that raises concerns about the effectiveness of the Pfizer vaccine against one of the concerning virus variants. Tell us more about that.
Well, Lindsay, this study's out of Israel, and it found that among people vaccinated by Pfizer, the South African variant may be more likely to break through and infect people than the UK variant, though it is worth noting these breakthrough infections are still rare overall. Lindsay?
Trevor, our thanks to you.
And now over to Dr. Walensky.
Andy, I'm glad to be back with you all today, and as is my usual, I will start with the data. Over the weekend, the CDC reported 75,000 cases and 81,000 cases of COVID-19 each day. As such, CDC's most recent data show the 7-day average for new cases has increased about 3% over the prior 7-day period to over 66,000 cases daily. Hospital admissions also continue to increase. The most recent 7-day average, a little over 5,300 admissions per day, is a 6.6% increase from the prior 7-day period. Vaccinations continue to increase with the most recent 7-day average of nearly 3 million vaccinations delivered daily, up 8% from the prior 7-day period. While these rates of vaccination are incredible and so encouraging for all of us, trends are increasing in both case numbers and hospitalizations. Across the country, we are hearing reports of clusters of cases associated with daycare centers and youth sports. Hospitals are seeing more and more younger adults, those in their 30s and 40s, admitted with severe disease. Data suggests this is all happening as we are seeing increasing prevalence of SARS-CoV-2 variants, with 52 jurisdictions now reporting cases of variants of concern. Based on our most recent estimates from CDC surveillance, The B.1.1.7 variant is now the most common lineage circulating in the United States. Testing remains an important strategy to rapidly identify and isolate infectious individuals, including those with variants of concern. These trends are pointing to two clear truths. One, the virus still has hold on us, infecting people and putting them in harm's way, and we need to remain vigilant. And two, we need to continue to accelerate our vaccination efforts and to take the individual responsibility to get vaccinated when we can. We have to recognize the high risk of infection in areas of high community transmission. I encourage communities to consider adjustments to meet their unique needs and circumstances. The trends in increasing cases and transmission also underscore the importance of President Biden's announcement that all U.S. adults will be eligible to receive a vaccination by April 19th. I want to close by acknowledging the two important truths of this moment. There is still reason for us to be concerned with rising case counts, rising variants reported, and increasing hospitalizations. And there is so much reason for so much hope. Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky.
So last week, right here at 5 o'clock, we told you about those so-called breakthrough cases. It's when fully vaccinated people contract COVID more than 14 days after their second shot.
The nation's top doc, Dr. Anthony Fauci, said he is taking these cases very seriously. And as Louis Bolden reports, the cases are popping up around the country, and there are many breakthrough cases right here in Central Florida.
The first thing somebody says to me is, "You got the vaccine. How are you positive?"
27-year-old Hannah Rewerts is a physical therapist and has been tested for COVID-19 at least once a week for work since the pandemic started. She says she got her first positive test just days ago.
I was shocked, immediately. I'm like, this has to be a false positive. This can't be right.
But multiple tests confirmed it. She says she was shocked because she is also fully vaccinated. As a healthcare worker, she had her first dose of the Pfizer vaccine back in December and her second dose 3 weeks later in January. More than 2 months after the second shot, she says she contracted the virus.
So it's very odd.
Rewerts is among a growing number of people. Earlier this month, the Minnesota Department of Health released a health advisory that, along with the CDC, it is investigating COVID-19 infections among people who are appropriately vaccinated, also called breakthrough cases. News 6 checked, and as of last week, the Florida Department of Health in Volusia County has 6 documented breakthrough cases. Sumter County has 6 breakthrough cases, and Lake County has 26 cases. Breakthrough cases are not specific to COVID and can happen with any vaccine, according to experts. Rewerts says 3 of her family members who were also fully vaccinated also contracted it.
One of my family members, actually went to the hospital. I mean, that's pretty severe enough to be concerned about the vaccine.
Rewerts says the health department is testing to see whether she may have been infected by one of the COVID-19 variants that have made it to Florida. She says for now, she and her family will continue social distancing and wearing masks.
I don't think the public is, aware that it doesn't mean you're not getting the virus, and it doesn't mean you're not getting sick. There is still a chance.
Researchers are still trying to figure out whether people who are fully vaccinated and contract COVID-19 can also continue to spread it, which is why they still recommend that people continue wearing masks even after being vaccinated. Getting results, I'm Louis Bolden, News 6.
The virus still has hold on us, infecting people and putting them in harm's way, and we need to remain vigilant.